My name is Marta Lomazzi. I'm the Chief Operating Officer of the World Federation of Public Health Association. The word I would choose is connection, because now more than ever, we need to take advantage of the Congress to be connected one to each other, independently from where we are based, independently from the challenges we are facing. As we all know, the geopolitical situation globally is extremely challenging. War, undermining of the health system, lack of support to health professionals, etc. And we need to be connected, to have a strong, bold voice to support global public health everywhere in the world. As very much linked to the theme of the Congress around equity, sustainability, we need really to help each other, to learn from each other, and to support each other. So to make sure that the health professionals around the world are enabled to do their job, are protected while doing their job, and can, at the end of the day, be a resource for the community, which is something that is extremely complex in a country with war, or where the human rights are not respected, or where the health system is weak and political decisions are impacting and weakening more and more the policies and the activities around health. So being connected is being supportive to each other and having one voice towards a politician around the world to make sure we support strong and sustainable global public health. So I had the pleasure to attend several World Congress from Kolkata, Australia, Rome, etc. And I've seen a very interesting development in our Congress and in the vision about public health. So first of all, we see more and more space for South-South, South-North collaboration, and the exchange is extremely rich. So we are somehow moving the paradigm to a decolonized approach to public health. There are enormous resources in knowledge from every single country in the world, and I see this is a reality that is growing and growing, and more space is given during the Congress to give visibility to these new country or new contexts that were maybe a bit less visible in the past. And this is what we expect in Cape Town, in South Africa, to see a strong voice from Africa, from which we can all learn a lot. And this is also very much aligning with the new ecosystem of public health we are observing in this last year. A shift in the donor path, a shift in the power sharing among department institutions, among countries, a shift in the global power and in the global economy, and all that has an impact on public health. So I believe we should learn from everyone, everywhere, learn and understand the new path, starting from donors' approach, to make sure we take advantage of this new scenario to create a more sustainable system for public health. So, Health Without Borders is the goal, is a vision. Of course, we cannot expect to solve it with one Congress, but it's a vision that we are bringing together through a series of Congress editions, but also through the activities that the Federation and its members are doing since many years. So I believe equity is the central word, and I believe we should focus very much on that to make sure that whatever decisions are made by policymakers, by health institutes, by the health community, have this lens to make sure we start protecting the most vulnerable. With this lens, I believe we can really put the attention on a reframing of all the activities presented during the Congress, so that when we go back home, we can bring with us this new approach of equity and, of course, sustainability, to make sure that all our activities and programs, independently from where we are based, are shaped to protect our community, starting from the most vulnerable. I would like to make this call a call to action. every single health professional can be and should be a leader within his or her working environment. Could be the community, could be with the Minister of Health, in academia. We should all take the ownership of what we can do in public health and be bold in our daily work life. Be bold when we meet people, when we do advocacy, because although public health is extremely important, we need to be stronger in communication and in the advocacy. And this is not something that should be done just by a few key opinion leaders. It should be done by every single person in public health, because we can all make a change. Could be a small one, could be a big one, but if we want to have a better global public health, we should all take our own responsibility and ownership of the impact we have on public health. I'm just looking forward to meet many colleagues in Cape Town. It will be an amazing occasion to learn from South Africa and Africa in general, but also from colleagues from all over the world. And in this very complex period, I guess we need that more than ever.